Welcome back to Soda City Live. June is Alzheimer's Awareness Month, and according to the Alzheimer's Association, there are nearly 7 million Americans living with the disease, with more than 112,000 right here in South Carolina. Many of these individuals, they depend on their families for a bulk of their care, and maybe this is new to you and your family, or maybe you're in need of resources. Our guests today have a few of those resources to help you to identify a few resources that may be accessible to family caregivers. Gerontologist Dr. Macy Smith and Allie Cornegay, the executive director of the Orangeburg Senior Helping Center, a PACE healthcare program, join us today to tell us a little bit more. Ladies, thank you so much for joining us.
Thank you for having us.
Well, we're going to jump right in. We know it's Alzheimer's Awareness Month. What are some things that family members should be looking out for? What is within their rights as a caregiver? Let's start there.
You know, Sierra, sometimes it's difficult for family members and for the individuals to determine if it's Alzheimer's or not. And so if it's something other than normal age memory loss, forgetting where you put your glasses, forgetting where you put your keys and you can retrace your steps, you're okay. But it's when that memory loss gets progressively worse, more often, and now they're not remembering how to do routine tasks such as making a bed or baking a cake. That's when there's a concern, and you want to actually seek assistance from the primary care doctor to determine what it actually is. But I want to say, and I want to say very loudly, that people with Alzheimer's disease can and do live well beyond measure with resources. It's just knowing where those resources are and how to access those resources that really make a difference.
And you know, one thing I think is very important is to identify the way in which we care for those family members, because as you've mentioned so many times on the show, they're still humans, they still have their rights, they still, and it's just your job as a caregiver to just assist them in the areas where they can't. So let's talk about that a little bit.
Not to take over control.
Right.
They don't need you to reparent them. That's where it's not going to go well. And so they just need you to partner in their care. They still have to take the lead on making decisions, but you have to bring the resources to them. You have to bring them reasonable choices so that way they can make good choices. You don't want to leave them out there by themselves, but you don't want to take over either. They're still the matriarch or the patriarch of the family, and so you shouldn't go in and say, you need to do this and you need to do that. You want to partner with them and say, how do you feel about this, or how do you feel about that? And so one of the resources that we have here today is PACE, Program of All-Inclusive Care for the Elderly, which is very much underutilized, and I think it's a gem in the community that many people just don't know a lot about.
Yeah, and I think that's a great segue. We're going to jump right in to speak with you, Allie, because there are some family members that are taking care of their family member that has this disease, but they're not able to be with them 24/7, and that's where those programs like PACE jump in. So tell us about that.
So the great thing about PACE is we're able to provide not only health care but also insurance coverage. A lot of the things that help the family members is just us being able to help with them being able to come to the adult daycare center. That's just kind of breaking up their day. It's giving them routine, which is very important when you're dealing with cognitive issues. Also just being able to have transportation, being able to have help with medication management. A lot of times when you're having confusion, did they forget to take their medicine, they can't remember if they took it, there's just a lot of different things that we're able to provide to keep them independent in the community as long as possible.
So healthcare management. I love that term. I love that term. Tell us a little bit about where PACE is located, how folks can get involved with the program, and anything else that may be beneficial to our viewers.
Absolutely. So our PACE is located in Orangeburg, South Carolina. We service Orangeburg, Bamberg, and Calhoun counties. We service anybody over the age of 55 that meet level of care for a nursing home placement. And our goal is just to keep them in the community as long as possible and as safe as possible, and also to be able to help family members as well.
Absolutely. And are these resources available throughout the week or on the weekend as well?
So PACE is 24/7. We have on-call where if any family member has any questions, they can give our on-call, speak to our doctor. We have nurses on-call 24/7 as well. We have our clinic that is open Monday through Friday. We have our transportation that is on call as well should they need assistance to get picked up from the hospital, go to a doctor's appointment, schedule anything like that. We have all of those things available.
Amazing, amazing. And where can folks go? Do they need to register for this? Do they need to be pre-approved? Because I know you mentioned insurance was the aspect of it. How does one get make PACE a part of their healthcare program?
Absolutely. So PACE is able to provide services. It's a referral-based program. So you would be able to reach out to us, whether it's on Facebook, whether you're just giving us a call, which we'll have our number up, I'm sure. Also just being able to go to the website, or you can get a referral from your doctor, and they can send us the information so we can contact you.
Perfect.
Now, it is covered through Medicaid and Medicare. So if a person is duly eligible, that's another, I think, bonus.
Yes.
It is a Medicaid covered service. Right. And so a lot of times Medicaid doesn't cover the gamut of what you need. And this is an all-inclusive care program. And so you can drop them off, transportation can pick them up, and they'll be taken care of throughout the day. Engagement, they also provide in-home care provider during the day to get them ready for the program and when they come home. And so when I say this is an underutilized, amazing service, it really is. And so again, people with Alzheimer's disease can live well and do live well with adequate support.
Absolutely, and we have a couple other resources that we want to share with our viewers today. So we mentioned PACE. You mentioned there's also the Area Agency on Aging, Lisa's Care Connection, which you've worked very closely with the Alzheimer's Association, where we got the statistics that we mentioned earlier. Let's talk a little bit about some more of those.
So Get Care SC, that's www.getcaresc, is a repository of all types of services that you may need for your loved one who's aging and or disabled. And that's managed by the Department on Aging. You plug in your zip code and you plug in what you're looking for, and the resources will come up. The awesome. Number, the address, call, get information, and really get your support services met, because you don't know what you need until you need it.
Absolutely. Well, Dr. Macy and Allie, thank you both so much for joining us today. Amazing resource, amazing information per usual. Dr. Macy, how can folks get in touch with you or see where it is you're going and some more of the resources that may be out there for them?
Thank you so much for asking. And I'm online at drmacysmith.com, and I'm available for consultations. A lot of times families don't know what to expect. Call me, set up a consultation, and I'll help you map out your long-term care journey.
Perfect. Thank you so much. And Allie, where can folks go for more information about the PACE program?
You can give our marketer a call, and that's 803-268-5301, and that's going to be to our marketer, Amber.
Perfect. Again, ladies, thank you once again. We're going to take a quick break. We'll be right back with more Soda City Live. And guess what? We're also going to be in the kitchen at some point, so we hope you packed your appetites. We're going to be right back with more after this.